Imagine wanting to feel fully connected, vibrant, and confident in every part of your life, but then finding yourself held back by something that's often, well, embarrassing to talk about. For millions of men around the world, this isn't just some hypothetical scenario. It's the daily reality of erectile dysfunction. And it's really not just a physical thing, is it? It digs deep into mental well-being, confidence, quality of life, that unspoken struggle, feeling isolated, the hit to intimacy. It's a huge concern. Welcome to the Global Men's Wellness Podcast. Today, we're tackling this significant issue head-on. We're looking at erectile dysfunction, or ED, not just as a diagnosis, but as a key piece of men's health impacting sexual function, how we age, just the basics of living a good life.
Absolutely.
And our main focus will explore the latest understanding of ED and, really importantly, a promising new treatment. It's a novel use of botulinum toxin. Botox, specifically for guys who haven't had luck with the usual therapies.
It's definitely a topic that touches so many lives, yet, like you said, often stays in the shadows. So before we jump into the cutting-edge stuff, maybe let's just clarify the basics. What exactly is erectile dysfunction? Put simply, it's the consistent inability to get or keep an erection firm enough for, satisfactory sexual activity.
Right. And it's definitely not always what people think. You hear it talked about like it's just part of getting older, but that's really painting with a broad brush, isn't it?
Oh, completely. Think of ED, maybe like a check engine light on your car. It's rarely just one single thing acting up. Age can be a factor, sure, but it's far from the only one. Things like diabetes, chronic stress, heart problems, those are major players. And while mental health definitely affects sexual function, it's a big misconception that ED is, quote, all in your head. It's a real medical condition. It's this complex dance between physical factors and sometimes psychological ones, too. Ignoring it. That's like ignoring that engine light. The root cause usually just gets worse.
Okay, so to really get why these treatments, especially the newer ones, might work, let's dig into the biology a bit. How complex is the process of an erection? What actually has to happen?
Yeah, it's actually quite amazing when you break it down. Far more intricate than people generally realize. You could think of it like a symphony orchestra.
Okay.
If even one instrument is off key, the whole performance kind of suffers. So fundamentally, an erection needs three main things working together perfectly. First, you need healthy blood vessels, good, strong arterial flow, letting blood rush into the penis.
Right, the plumbing.
Exactly. Then you need precise nerve signals, neurovascular coordination. These are like the conductor, telling those blood vessels exactly when to open up and how much. And finally, hormones matter, especially testosterone. It plays a big role in keeping the whole system healthy and responsive. So if any one of those parts, vessels, nerves, hormones is compromised by disease, injury, or even stress, well, that ability to get or keep an erection can really take a hit.
It really highlights how interconnected everything is. Now, over the years, we've seen treatments evolve quite a bit. It used to feel like options were pretty limited, but that's changed, right?
Oh, absolutely. It's been quite a journey. We've gone from some pretty basic, often cumbersome approaches to a whole spectrum of effective therapies now. Most people know about the pills, the oral meds, specifically PDE5 inhibitors. That's your Viagra, Cialis, that class of drug. They were revolutionary for many, and they work well for a good chunk of men, maybe 70–80%.
Okay.
But beyond pills, you've got vacuum devices, which physically draw blood in. For tougher cases, there are injections meds injected right into the penis, and even surgical implants, which actually have incredibly high satisfaction rates, often over 90%, plus newer things like shockwave therapy, trying to improve blood flow long-term. So, yeah, there's a solid toolkit available now.
That is a pretty comprehensive list, but this is where things get really interesting, especially for men who feel like they've tried everything and are still stuck. What about that group, and it's not a small group, where these standard treatments, even things like Trimix injections, just don't cut it? That must be incredibly frustrating.
That's exactly the group this new approach is targeting. We're talking about injecting botulinum toxin A, Botox, into the cavernosal tissue. And let's be clear, this isn't a first-line treatment. It's not where you start.
Right.
It's a potential game changer for men who are considered non-responders to the usual drugs, including those PDE5 inhibitors, and even the more potent custom-mixed injections like Trimix. The early research suggests Botox might last quite a while, especially at higher doses, which could be huge for long-term management.
Okay, so if this Botox idea holds so much promise for this specific difficult-to-treat group, why haven't more people heard about it? It feels like men's sexual health issues are still kind of whispered about.
Yeah, you've hit on a really key barrier. There are a few reasons awareness is low, especially for less common treatments. First, there's still this lingering stigma and embarrassment. It just stops men from talking about it, even with doctors sometimes. That cultural taboo is a big factor. Plus, honestly, a lot of men just think the pills are the only real option. They're totally unaware of the other effective treatments out there, let alone something newer and maybe less intuitive like Botox. It really comes down to needing more education and open conversation.
So if someone is considering this, what's the process like? From walking into the doctor's office to actually getting the injection, what should they expect?
The initial workup is pretty standard and aims to be reassuring. Usually it involves talking through your medical and sexual history in detail. Simple blood tests check overall health, hormone levels, that kind of thing. And often, imaging like a penile Doppler ultrasound is done. That helps confirm if the issue is mainly blood flow, what we call vasculogenic ED. The whole point is you shouldn't be left guessing. Care is very personalized now.
Okay, that makes sense. And the actual BOTOX procedure described in the study, how does that work?
Right. Based on the key study, it's quite specific. After checking the area and prepping it, the BOTOX solution gets injected carefully into 4 spots in the penis shaft, 2 on each side, sort of an inch back from the head and an inch up from the base, into the main erectile chambers, the corpora cavernosa.
Okay.
After the injections, there's a gentle massage of the sites for about 5 minutes. Then a soft band is placed at the base of the penis for maybe 20 minutes. That helps the medication spread out and get absorbed properly. And importantly, in this study at least, it was typically just a single treatment session.
Wow, a single injection. That sounds way more appealing than daily pills or having to do self-injections regularly, which must be a barrier for some guys.
Yeah.
But how does BOTOX actually work for ED? We think of it for wrinkles, relaxing muscles. What's the biology here?
That's a great question. And yeah, it's a different mechanism than smoothing wrinkles. It's more about fine-tuning the vascular system in the penis. So the thinking is that BOTOX inhibits the nerve signals that tell the blood vessels inside the penis to constrict, to tighten up.
Oh, yeah.
By reducing that squeeze, it lowers the resistance in those vessels. They relax more easily, allowing more blood to flow in. And there's more, the research suggests it might also boost the expression of natural growth factors like VEGF, which helps maintain healthy blood vessels.
Interesting.
So it's this combination, late constriction, potentially better vessel health, leading to increased resting blood flow and less background muscle tension in the erectile tissue. And importantly, it seems to work through a pathway that doesn't rely on nitric oxide, which is how drugs like Viagra work. That makes it a unique approach. Ultimately, it just makes it easier to get a solid erection when aroused.
That explanation really helps clarify how it's different. So, okay, the mechanism sounds plausible. The big question then is effectiveness. How well did BOTOX actually work for these men with really stubborn refractory ED in the clinical trial?
Yeah, they tested it rigorously. It was a prospective, randomized, double-blind, placebo-controlled trial. That's the gold standard design. Ran between 2016 and 2019. Included 176 men, aged 40 to 70, all with blood flow-related ED, and crucially, all had failed other drug treatments. So a really tough-to-treat group.
Right.
They were split into 3 groups. One got 100 units of BOTOX, one got 50 units, and one got a placebo, a saline injection. The results were, frankly, quite striking.
Okay, don't leave us hanging. What did the results show? Did it beat the placebo? Was one dose better?
Yes, significant improvement was seen in both BOTX groups, the 50 and 100 unit ones. And this was across the board, on all the ways they measured it. Objective things like Doppler ultrasound readings showing better blood flow, but also patient-reported stuff like the SHIM score for ED severity, the erection hardness score, satisfaction scores like the sexual encounter profile and global assessment score. Everything improved.
Wow.
Maximum improvement was seen around the 3-month mark. But here's the headline number. About 40% of the men in the BOTX groups became responders, meaning they could actually have intercourse again.
40% in guys who had failed everything else.
Exactly. A 40% success rate in previous non-responders, that's potentially life-changing for that group. It really shifts the possibilities for managing chronic ED.
Absolutely.
And yeah, the placebo group, no significant improvement, really confirms the BOTOX effect.
And the difference between the doses, did 100 units work better than 50?
That was interesting. At 2 weeks and 3 months, both doses worked about equally well. No major statistical difference, but where they diverged was at the 6-month follow-up. The 100-unit dose showed significantly better durability. Its effects lasted longer than the 50-unit dose.
Okay, so higher dose means longer effect. Makes sense.
And a couple of other interesting side notes. They saw a significant increase in stretched penile length in the BOTOX groups, suggesting maybe improved tissue health or elasticity, along with the better Doppler readings. But penile girth didn't change.
So effectiveness looks promising, especially that 40% figure and the durability of the higher dose. But safety is always the flip side. What did the study find regarding side effects or risks, especially with injecting something like Botox there?
Safety profile was actually remarkably good, which
Yeah.
is obviously critical. Only 4% of the men who got BOTX, just 5 out of 121, reported any adverse events. And these were mostly minor things right at the injection site, a bit of pain, maybe a small bruise. Pretty trivial, really.
Okay, that's very low.
Yeah. There were 4 guys who had prolonged erections during a follow-up Doppler test. Remember, those tests often use drugs to induce an erection for the scan. And one patient had priapism, a prolonged erection needing treatment, way out at the 6-month mark. But all these were managed conservatively, no surgery needed, and importantly, 0 systemic side effects, nothing affecting the rest of the body.
Right.
The researchers even suggested some of those erection issues might have been linked more to the drugs used during the Doppler test than the BOTOX itself.
That's actually a surprisingly clean safety profile, especially when you think about potential side effects from pills or the risks associated with regular self-injections like scarring.
It really is. Compare that 4% minor issue rate to, say, other injection therapies where dropout rates could be super high, 30, 50, sometimes even 80% because of pain, fibrosis, or just the hassle and fear. The study also found fewer people dropped out of the BOTOX groups, 9%, compared to the placebo group, 20%. That usually hints at good patient satisfaction with how well it works and how tolerable it is. This low complication rate for a single shot with lasting effects, it could really change how we think about managing ED long term, reducing the burden of daily pills or frequent shots.
Looking bigger picture than this BOTOX research, it feels like part of a larger wave of innovation in men's sexual health. Where do you see things heading? What are the next steps?
Yeah, this study definitely points to an exciting future.
Yeah.
Beyond just BOTX, research is pushing hard into regenerative medicine, things like stem cells, trying to actually repair damaged tissues. We're also seeing AI playing a role in diagnostics, telemedicine making care more accessible and personalized, and there's a growing focus on prevention, helping younger guys make lifestyle choices to preserve function down the road. But we should also be realistic about this specific BOTOX study. Like any research, it has limits. We need more studies. Future trials should probably include different types of ED patients, like men after prostate surgery, where nerve damage is often the issue, maybe broaden the criteria to include all men who don't respond to pills, not just those with confirmed vascular problems.
Right. See if it works more broadly.
Exactly. And definitely need longer follow-up, maybe years, to really pin down how long the effects last, plus maybe testing different doses, combination therapies. There's still a lot to learn and confirm, but it's definitely a promising direction.
So, wrapping this up, what's the main message you want our listeners to take away about ED and managing it today?
I think the biggest thing is you're not broken. ED is a common medical issue, and the really good news is that treatment works. And what studies like this BOTOX1 show is that even for the toughest cases, researchers are constantly finding new, effective, durable, and importantly, safe options. There's real progress, real hope.
Absolutely. It really starts with seeking care, opening up the conversation, maybe with your partner, definitely with your doctor, and just taking that first step. And it makes you think, given the safety we saw and how long that higher dose seemed to last, how might a single injection therapy like this truly change things long term? Could it free many men from the daily pill burden or frequent injections? It's definitely something to ponder.